Hello students, today I'm talking about the pulse of the human body. So when we want to look at the pulse, we need to do a bit of background. So this may be review for you, back to trimester 1. So when we consider the heart rate, we are thinking of the rate of contraction, and this is the number of beats per minute as the heart ejects blood from the left aorta when it's working as a pump. The pulse is a rate measurement of cardiac performance, therefore. It is how well the heart is pumping blood around the body. So, in quick review, you will remember that the heart has 4 chambers, and the pulse rate, when we're looking at the output of the heart, it's a focus on the left ventricle, because this is the area that pumps the blood to the body. The left ventricle contracts and pushes blood into the aorta, which is a very big blood vessel. Each contraction or beat pumps about 70 millilitres of blood out of the left ventricle, and this is called a stroke volume. When the stroke volume of 70 ml of blood hits the aorta, remembering that this is a big blood vessel, a very large and elastic muscular vessel, the aorta wall flares. So thinking about how it might flare like a muscle would because it is elastic. This sends a pressure wave through the systemic circulation to the other blood vessels in the body. And this is what you can feel as a pulse in different areas of the body. There are major blood vessels where this can be felt close to the surface, and that's what we're learning about today. One of these blood vessels is the radial artery, and you will have seen in movies and all kinds of TV shows, I'm sure, the idea that when people are taking a pulse, coming down from their thumb, they're going to feel into the wrist, and that is taking the radial artery pulse. So quick recap, you're thinking about your blood going in through your heart and your heart working as a strong muscular pump. And then as that volume of liquid goes into your aorta, a pulse, a wave in the elastic system of your blood vessels is then felt through the rest of your body. And when it's very close to the surface, like it is in your wrist, that's where you can feel the radial pulse. So, quick review. The stroke volume is therefore the amount of blood that's ejected from the left ventricle of the heart, the left side of the heart, and this is the most muscular area and the biggest side of your heart. And then your cardiac output is the amount of blood that's pumped by the heart in 1 full minute. So then you're thinking about your heart rate times your stroke volume, and that equals your cardiac output. So we need to think about or consider what actually influences our pulse. So if we're in a warm room, have you ever noticed that your heart rate starts to beat a bit faster and you notice that you have a little bit more sweating? And this is because of thermoregulation. The sweating and the blood vessels are vasodilating in your peripheries, and this means that you can then get rid of extra heat. Other things that can impact, so that's environment that's impacting there, and temperature. Volume. So if you have a decreased volume of blood, so perhaps you've had an operation on your knee and you've lost some blood that way, then this means that if you have a decreased volume of blood, your heart will have to pump harder to get the same amount of oxygen and nutrients around to your body. So that's a really quick impact, and that would be the volume of fluid that's going around your body is reduced, and then that means that your heart has to work harder, so it mainly works faster to make up that it's going to move that oxygen and nutrients to the rest of your tissues. Medications. So medications also impact. You might have heard of digoxin, and digoxin is the one that in Romeo and Juliet's story, that digoxin was given so that the heart rate was slowed so much that someone thought that she'd actually passed away. And so that's digoxin, and digoxin can be used therapeutically in a very, very tiny amount to slow down someone's heart rate. You might think, oh my goodness, why would I want to slow someone's heart rate down? It's because if your heart is working very quickly, it doesn't work as efficiently. So sometimes having digoxin, slowing the heart rate a tiny bit, means that it can work more efficiently. If you were going to give someone digoxin though, you would definitely want to take their pulse beforehand, because you want to check what is their heart rate. If I know that digoxin is going to slow their heart rate a little, I want to make sure it's already above 60 before I administer this medication. Another medication might be something like adrenaline. So we have endogenous adrenaline in our own body. So this is when you might find that if you're standing in a really tall building and looking over the edge, that all of a sudden your fingers are tingling, your pupils are dilating, your heart starts beating a bit faster because you are ready for the fight or flight emotion or response. And so we can also give you adrenaline if you are having a cardiac arrest or are very, very unwell. Adrenaline can help you have an increased heart rate and also increases the volume and strength at which your heart is pumping. You might have seen this in your life already, that emotions also impact. So when you're feeling stress, it can make your heart beat faster. It can also be hormones, or it can be that adrenaline I talked about just before. So emotions can also increase your heart rate. Exercise does have a stimulation on your heart rate as well. When you need to get more oxygen to your muscles, this means that your heart rate goes up and then your pulse will be higher. It's also a measure of fitness, how fast your pulse rate goes back to the normal rate that would be your resting heart rate. That's a measure of your fitness. So that's just another way that exercise might be impacting your heart rate and thinking about the normal being between 60 and 100 beats per minute. So now let's consider the pulses around the body. Another thing to think about pulses is that this is where the arteries are closer to the surface and more easily accessible. So this is an area, people call them the pulse points, where you might want to put perfume. And that is because your arteries are just closer to the surface. This means it's slightly warmer there, and of course the perfume is able to evaporate off your skin. So I'm sure you might have seen that. Someone will be putting perfume on their wrist, and perhaps in their elbow, and perhaps on their neck, behind their knees. They are our pulse points. So let's just look at this quick picture and check that we all know where these are. So you have your temporal, which is where your temple is. You have radial, and this is used primarily in your vital signs because it's so easily accessible in your wrist. You're coming down from your thumb and feeling into your wrist, and that's where you would find your radial pulse. You're going to practice this a lot in the sim labs. You want to think about your brachial. So your brachial pulse is deeper into under your bicep, and you're thinking about your antecubital fossa in your elbow. And this one is something that you need to practice so that you can take a blood pressure. So that's your brachial pulse. We also have your carotid, and that is here. So in your carotid, you must always only take one carotid pulse at a time. Otherwise, it's like a ninja death move if you were to do both at the same time, because you can cut off circulation to the brain and the person will faint. So just to make sure, only one carotid pulse ever at a time. You have the femoral pulse, and this is in your hip or where your leg attaches to your body. And so the femoral one, practice in the privacy of your own home. We're not going to ask you to do that one on fellow students, but you certainly can practice that one on the mannequins that we have in the sim lab. The femoral one is also an interesting one because if you have a patient who has a cardiac arrest and you're doing efficient and effective CPR, you might find that someone will reach for the femoral pulse to check how good your CPR is. Because if you are effectively doing chest compressions, you should feel some kind of output in the femoral artery. Isn't that interesting? Then we have the lower limb pulses. So we have popliteal. This one is behind your knee. This can be harder to find and takes practice to find, but it can be very useful if you're trying to work out, say someone has an upper leg restriction on them and you want to check that there's pulsing or there's blood flow going to the lower leg, then that's a way that you can do this by taking the popliteal pulse. People remember that one, but your knee might pop, and so that's where it is, it's behind the knee. Then we have the posterior tibia, and this one is on the inside of your ankle. So remember, your pulses need to be internal. They can't just be superficial, because otherwise if you would knock them, you would bleed and bleed too much. So your pulses, where your arteries are, need to be more hidden and deeper into the body. So that's a way to remember where that one, the posterior tibial one, is on the inside of your ankle. It's not just superficial on the outside of your ankle. And then we have the dorsalis pedis. Now this is an interesting one. The way to remember it for me is dorsal, like dorsalis, like a dorsal fin, and pedis on the foot. So if you imagine that your foot is a fish and you're thinking, where's the dorsal fin? Then you'll find the dorsalis pedis, quite interesting and quite easily. So the pedis meaning foot, pedestrian and things like that is a way to remember that one, and dorsalis pedis on the top of your foot. This one is so very useful and very essential to know where that is. I'm thinking back to someone that I cared for when I was in the rural and remote area, and I'm afraid they jumped off a horse and landed with both feet flat on the ground and had fractured ankles. And so when I was taking the dorsalis pedis and I could feel a pulse there, despite them having fractured ankles, I knew that there was still blood flow coming to the toes and to the lower foot. So that's very good. If I wasn't able to find the dorsalis pedis, it would then be a concern. Certainly if I saw the foot going pale or cold and then tingling and losing sensation, I'd be thinking, oh my goodness, this foot is now at risk. We need to actively do something very quickly to maintain the blood flow here. So that's why the pulses on the lower legs are really essential to know where they are. We also have an interesting one. So they're the pulses that I've mentioned. We also have an impulse, and the impulse is the apical impulse. So if you've ever laid on the left side of your body and maybe felt your heart moving against your chest wall, it's not strictly a pulse because it's not the wave felt through your blood vessels. It's actually your heart and actually your left ventricle moving against your chest wall, and that's why it's called an impulse. But it can be very useful if people have cardiac concerns, because if you're looking at when the pump is functioning and you're feeling the impulse there and then comparing that to your radial impulse, being that that's the output of your heart contraction, that's when it gets, they can gather more data to know if your heart is working as it should. So how do you find the apical impulse? That one is in the left side of your chest in the 4th or 5th intercostal space, depending how old you are. It can be tricky to find because women have breasts and also people have adipose tissue on their chest wall to find that. But if you have people who are on the thinner side, you can even see it moving slightly there in the intercostal space, but you should certainly know where it is. So it's on the mid-clavicular line, meaning halfway across the clavicle coming down, and in the 4th or 5th intercostal space. So yes, that is certainly a very interesting one, and that is an impulse. So we have a quick picture here just to recap that. So we have our radial pulse, and that is on our thumb side. Then you'll see that there's also an ulnar pulse, which is on the opposite, it's not, I guess, on the opposite side, but it's on the other side where your little finger is. And the ulnar pulse is usually a lot smaller than the radial pulse. So that's why you need to know where the radial pulse is. Then we have the brachial, which is where you're going to put the stethoscope so that when you're listening for your blood pressure, so that you know when the pulse actually comes in, that you're looking for that blood pressure reading. So that's very useful for the radial and brachial, and we're going to practice those in the sim labs. So other things to notice. So I guess I've already covered about how you would find them, but just to restate this, you actually need to use your finger pads and lightly place them. It's particularly your first and seconds. Please never use your thumb because you're using your thumb has a pulse, and so you'll just take your own pulse, so that's not useful at all. So yeah, so second and third, and you're thinking about your finger pads, and it's along the groove formed on the thumb side there. Other things to think about, you are going to be counting the pulse rate for a full minute on someone that you don't know, and that is because you're also looking for a rhythm. You're looking for, is the pulse regular or irregular? Because there are some cardiac conditions that are found by nurses simply taking pulses and noticing that someone has an irregular heart rate. Certainly patients who are under stress, and that might mean that recently had an operation or acutely unwell or perhaps even chronically unwell, that if you notice that there's an irregular heart rate, that this would be something you would need to act on, because it might be something called atrial fibrillation. Their heart is not working as effectively as it possibly could. We also look at the force, which is an interesting thing, isn't it? And this is graded in this little graph that's on the screen. So 2+ is normal, 1+ is weak and thready, and 3+ is bounding. So maybe you're running on the treadmill in the morning and you take your pulse and you really notice it's like boom, boom. Now that would be classed as a 3+. Perhaps you've been in Bali and you've had some diarrhea and vomiting, and you take your pulse when you're in the shower because you're feeling a bit dizzy and lightheaded. You take your pulse and you're like, it's not normally how it is. It's normally a 2+, but it feels a bit weak and thready because I haven't got enough circulating volume because I've had so much vomiting and diarrhea, losing fluid. So that's what that 1+ compared to 3+ would be. And then 0 would be absent. So if you had a carotid pulse of 0, you would immediately need to start CPR. So yeah, that means you actually haven't got a pulse. The other thing to note is symmetry. So the left side should be the same as the right side. And this is really, you know, I use this one all the time as a first aid person. So sometimes people will come off a netball or football field and they'll say, oh my goodness, my thumb is painful in this area or whatever. And so immediately I look at the other arm to compare what this arm looks like. In the same way, you need to be able to take a pulse on one side of the body to compare that to the other side of the body. One kind of example of this is, say you've got a knee brace on your right leg and you're thinking at 2 o'clock in the morning, I'm not sure that there are very good pulses, the dorsalis pedis or the posterior tibial pulse is not as good as it was earlier. Remember, you would check compared to the other foot. And that's a way to go, yes, this is actually something we really need to act upon, and maybe it means that the brace around the knee needs to be reduced or, you know, just widened a little bit, or it might even mean that the person needs to go back to theatre. So it's important to notice these lines of symmetry between the right side and the left side of the body. It's so helpful. Okay, so the normal pulse rate for an adult is 60 to 100 beats per minute. So for the people who are studying paediatrics or might be interested in looking after children later, of course, this, as you get younger, the heart rate actually becomes faster. But just for this course, you definitely need to be familiar with what the adult is, which is 60 to 100 beats per minute. The other elements of being a normal pulse would be that it's a 2+ and that it is regular and that it is symmetrical right side compared to the left side. Okay, so that's beats per minute. Please never forget the units. There's some new terms to put into your vocabulary. So bradycardia, tachycardia and asystole. So one way to remember this is bradycardia does sound slow. So let's go with this. Bradycardia, like that, less than 60 beats per minute. Brady sounds slow. Then tachycardia sounds fast just in the beginning of the word, and that means more than 100 beats per minute. So there's just some quick way to remember those terms. And asystole means that there's an absence of a pulse. So now we're just going to go through a quick activity, the different pulses of the body with some pictures. And I'm just going to cover if it's an easy pulse to an easy pulse to palpate, and why would we use that pulse site, or when do we use these pulse sites. So this is the brachial pulse, and this one is very useful for when you're taking a blood pressure. It's easy to access, but it does take time to master, so you want to practice this one when you're in the sim lab, and not just on a familiar person. You might want to practice it on other students. That's what we encourage you to do, to learn to take the blood pressure on your friends, and then obviously practice on other people in the sim lab, maybe even your sessional staff as well. With the brachial pulse too, it can be useful to try this first on a man, because there might be more blood flow due to the musculature in the upper arms. So that's why you might be able to feel it easier. So just to consider that one. The next picture we have, so this is the femoral artery. So this one isn't one, because it's quite invasive, it isn't one that you would routinely need to access to take a blood pressure or anything, or just when you're taking normal vital signs, say every 4 hours. But this one indicates if you're getting blood flow to the lower limbs. So that's why you need to be able to find that femoral pulse. Next picture we have is the radial pulse, and you'll see that that's on the thumb side of the patient. So that's certainly an error that new people often make, that they'll try and take a pulse on the little finger side, and that won't be as strong, and it's more difficult to find. So you can see that that one's easy to access, and it's not too invasive, and something that you really want to practice I did mention about taking a pulse in other students in the sim labs, but of course you can take your skills home, and I think it's really useful to also think about across the lifespan. So thinking about some older people to take pulses on, anyone that you have access to that you can practice taking a pulse on would be absolutely really welcomed. This is the apical impulse, and so this is in the 4th or 5th intercostal space on the mid-clavicular line, and that one's a good one to practice perhaps on yourself to feel your heart move against your chest wall. This one is the carotid pulse, and of course I'm going to say this again, only one side at the time because you don't want to cause anyone to faint. This one's easy to access. When would we use it? We would use it for CPR, so if you're worried that someone needs resuscitating, it's a really good way to find their heart rate and their cardiac output, because your heart, lungs and brain will always be protected with having oxygen and nutrients going to it. You might find it difficult to find your radial pulse if you have a weak and thready pulse, but you should always be able to find the carotid. So that's very useful in an emergency situation. The next picture here we have is the popliteal pulse. So this is behind the knee. I think I've already explained when this one would be useful, and it's difficult to find on all people due to adipose tissue or just the angle, but you should certainly practice this one. This one is the dorsalis pedis. People talk about acting like you're going to have it's kind of like a fish, that you've got this the lateral extension of the big toe line coming down the top of your foot, and so that's where you'll find that one. When patients are going to theatre to have operations on their legs, usually you'll get an X marks the spot. Before someone goes into an operation, there'll usually be an X where you can find a pulse, and that would help you when they've come back from theatre to know that that's where that pulse is. So that can be really useful. And this is the posterior tibial one. So this is kind of the idea that you would give the foot a handshake. See how that it's kind of like a attitude of the handshake, and that it's going to be deep into your ankle, and your finger pads need to be on the inside of your ankle. That is a constant error that people make in the OSCA. They always go for the outside of the ankle. Please note that the pulses are arteries, so they're going to be deep in your body. They're going to be on the inside of your ankle. So that's it for the pulse today. Thank you, students, for watching this video. Remember, the pulse rate is 60 to 100 beats per minute. It is expected that it would be regular to be normal, and it would also be a 2+. So thank you very much.